The cardiovascular system. The cardiovascular system consists of two main components. Part of the heart itself. Part vascular. The circulatory system therefore comprises a pump called the heart, blood vessels, arteries and veins, that carry blood, oxygen and nutrients throughout the body to cells and tissues, and remove waste products. The heart is a striated hollow muscle, which contracts rhythmically to ensure the flow of blood through the blood vessels. This automatic rhythm, which is unique to the heart muscle, is made possible by a specific type of tissue known as the nodal tissue, which possesses electrical properties. The heart has a built-in electrical circuit. It comprises 4 chambers, 2 atria and 2 ventricles. The heart has its own circulatory system that supplies it with blood. It is supplied by the coronary arteries and veins. Heart location. The heart is located in the chest, between the 2 lungs, above the diaphragm. It is located in the anterior mediastinum, behind the sternum, and in front of the spine. Mediastinum, the central region of the chest located between the 2 lungs, the sternum and the spine. External configuration of the core. The heart is shaped like a triangular pyramid and is firm and red. It weighs 300 g in men and 270 g in women. It has a base, a vertex and 3 faces, anterior or right, posterior, left, and inferior. Its base is posterior and straight, formed by the 2 auricles separated from one another by the interauricular sulcus. Its tip, known as the apex, is anterior, towards the front, which means that the heartbeats can be felt at the level of the 5th left intercostal space, intercostal gauche. 1. Of the anterior, right, surface of the heart. It consists mainly of the right ventricle and the right atrium, separated by the right atrioventricular groove, which receives, at the top, the superior vena cava, SVC, and at the bottom, the inferior vena cava, VCI, and extends superiorly and anteriorly into the right atrium, RA. Behind the right atrium, the posterior right border of the left atrium, LA, is visible, into which the 2 right pulmonary veins flow, superior and inferior. B. A right ventricle. It is not very visible. It continues upwards into the pulmonary artery, which branches off as it travels upwards, and to the left, more clearly visible in a left-sided view of the heart. Between the pulmonary artery and the superior vena cava lies the right side of the ascending aorta, best seen in an anterior view of the heart. The right coronary artery runs through the fatty tissue of the right atrioventricular groove, L-artery, coronary adroit, CD. 2. Of the posterior, left, surface of the heart. The left side of the heart consists mainly of the left ventricle, LV. Above this is part of the right ventricle, from which arises the pulmonary artery, PA, which branches into 2 branches, the right and left. Behind the left ventricle lies the left atrium, LA, which receives the 2 left pulmonary veins and extends upwards and forwards into the left atrial appendage, LAA. The anterior interventricular artery, AIV, runs through the anterior interventricular sulcus, accompanied by the great coronary vein, which then passes into the left atrioventricular sulcus. 3. The underside. It rests on the diaphragm. It is also divided by the atrioventricular groove into 2 parts. These 2 parts are essentially formed on the underside by the right atrium and the right ventricle. 4. The posterior view of the heart. The base, it is situated on the posterior surface of the left atrium, LA, where the 4 pulmonary veins, right and left, enter. On the left side of the left ear, the left auricle, AG, is visible. Above the auricle, the bifurcation of the pulmonary artery, PA, and the aorta are visible. To the right of the left atrium, the posterior surface of the right atrium is visible between the superior vena cava, SVC, and the inferior vena cava, IVC. Below and to the left of the left atrium, the inferior and left walls of the left ventricle, LV, can be seen. The great coronary vein, GCV, runs through the left atrioventricular groove. Internal configuration of the core. The heart is divided into 4 chambers by a vertical septum and a horizontal septum into 2 upper chambers, the atria. 2 lower chambers, the ventricles. The 2 atria are separated by the interatrial septum, the wall between the 2 atria. The 2 ventricles are separated by the interventricular septum, IVS. The atria communicate with the ventricles via the atrioventricular openings. 1. The right cavities. A. Right atrium. It is a smooth cavity, elongated at both ends, lower and upper, into which the inferior vena cava opens at the lower end and the superior vena cava at the upper end. The superior vena cava opens directly into the right atrium. In contrast, the inferior vena cava has a valve, Eustachian valve. The septum between the 2 atria contains a remnant of fetal development that can be felt when the child is born, foramen ovale. In the lower part of the right atrium is an opening formed by a fibrous ring into which the tricuspid valve is embedded, connecting the right atrium to the right ventricle. B. The right ventricle. The right ventricle is shaped like a trunk and is attached to the left ventricle. The thickness of the wall separating them, known as the interventricular septum, is 5 mm. It has muscle bundles to which the tendinous cords are attached. These pillars and cords form the attachment system of the tricuspid valve. The tricuspid valve consists of 3 leaflets, a septal leaflet, an anterior leaflet, and a posterior leaflet. Between the right ventricle and the pulmonary artery lies a valve known as the pulmonary sigmoid valve, composed of 3 leaflets. Contraction of the right ventricle pumps blood into the pulmonary artery. 2. The left cavities. A. Left atrium. The left atrium receives the 4 pulmonary veins, the superior and inferior right pulmonary veins, and the superior and inferior left pulmonary veins. The left atrium communicates with the left ventricle via the mitral valve, or bicuspid valve, consisting of 2 leaflets. It is also attached to the left ventricular wall by pillars and chordae tendineae, which prevent blood from flowing back. B. Left ventricle. The left ventricle is cylindrical in shape, with a wall thickness of 1 cm. It accounts for the bulk of the heart's muscle mass and communicates with the aorta via the aortic orifice. At this opening is located the aortic valve, which consists of 3 semilunar leaflets that prevent blood from flowing back from the aorta into the left ventricle. The aorta is the body's main artery. It gives rise to all the body's arteries and numerous collateral branches, and divides in the small pelvis into 2 primary iliac arteries. The path of blood through the left ventricle: inflow into the left ventricle via the mitral valve, outflow from the aorta via the aortic sigmoid valve. Tunics of the heart. The heart wall is not made up solely of muscle, but is divided from the inside out into 3 layers. Inner lining of the heart. Myocardium. Epicardium. The endocardium. This is the innermost layer, less than 1 mm thick, that lines the entire heart. This is a thin endothelial layer that is attached to the underlying muscle layer by connective tissue. There is a lack of proper blood supply. Function: its smooth surface allows blood to flow without friction, thereby preventing the formation of clots. The myocardium: this is the heart's muscle tissue, the thickness of which depends on the function of the chambers. It is thin at the auricles, but particularly thick in the ventricles. Function: the myocardium is capable of contracting, which enables blood to be ejected. It thus enables the heart to perform its pumping function. The pericardium: it is the outer layer of the heart, consisting of two layers: internal serous pericardium, outer fibrous pericardium. The inner pericardium, in turn, consists of two layers: the visceral layer, which is in contact with the myocardium, and the parietal layer, the epicardium. The pericardial space, between the two layers, contains a small amount of fluid, 50 to 75 milliliters, to facilitate the heart's movements. The circulatory system. Blood circulates within a completely closed system. Blood vessels form the network that supplies all the organs with blood. The circulatory system consists of heart, the organ that receives and pumps blood. Arterial network, comprising arteries. Venous network, composed of veins. Between the two systems, arterial and venous, lies the capillary system. The arterial network. The arterial system consists of arteries, blood vessels that carry blood from the heart to the organs under high pressure. We have large arteries, medium-sized arteries and small arteries, arterioles. Capillaries are branches of arterioles. These are very fine blood vessels located within organs that form networks enabling the exchange of substances between the blood and the cells. Arteries are the blood vessels that lead away from the heart. The pulmonary artery emerges from the right ventricle and divides into two branches to supply each lung. The aorta emerging from the left ventricle forms the aortic arch, which curves around the heart, and from which the following branches. The coronary arteries that supply blood to the heart. The brachiocephalic trunk, which supplies blood to the upper part of the body, the head, neck and upper limbs. The intercostal arteries, the celiac trunk, which supplies blood to the abdomen, stomach, liver, intestines, kidneys, reins. Les artères iliaques et fémorales. Capillaries. These are very thin blood vessels, 5 to 2 m, and are very numerous, 3,000 per cm squared of skin. Blood flows through these vessels, dripping slowly. Capillaries form an intermediate network between arteries and veins. The wall is very thin, which allows dissolved substances to diffuse very quickly, site of exchange with the cells. The capillaries then merge to form venules, the smallest units of the venous system. The venous system. The venous system consists of veins, which are blood vessels that carry blood at low pressure from the organs back to the heart. We have large veins, medium-sized veins and small veins, venules. Veins have a thin, elastic wall and are equipped with valves that prevent venous blood from flowing back into the capillaries. Most veins follow the course of the arteries and are often even enclosed within the same protective sheath. Blood circulation. The circulatory system consists of two circuits. The pulmonary circulation, known as the small circulation, which serves to oxygenate the blood in the lungs. The systemic circulation, general circulation, which supplies all the body's organs, with the exception of the lungs, and performs various functions, transporting nutrients, gases, waste products, hormones, etc. The heart pumps blood throughout the body by contracting. The heart is divided into two parts that do not communicate with each other, the right half of the heart and the left half of the heart. Each of these chambers consists of two cavities, an atrium and a ventricle. Each atrium is connected to the ventricle below it via an atrioventricular valve, which can be open or closed. Each chamber goes through successive phases of contraction, systole, and relaxation, diastole. The right side of the heart supplies blood to the lungs. The left side of the heart supplies blood to the rest of the body. Blood always flows in the same direction, both in the right and left sides of the heart. It enters the atria via the veins and leaves the heart at the ventricles via the arteries. They operate in perfect synchronization. There are two reasons for this. Each of the atrioventricular openings is equipped with a valve that prevents blood from flowing back from the ventricle into the atrium. The atria and ventricles contract in succession. Some definitions. Systole, contraction of the heart. It occurs in two phases. Atrial systole, the atria contract and eject blood into the ventricles. Ventricular systole, contraction of the ventricles, forcing blood into the circulatory system. Once the blood has been ejected, the two sigmoid valves close. Diastole, relaxation of all parts of the heart. The ventricles fill passively. Heart rate, this is the number of beats per minute. At rest, approximately 70 bpm. Cardiac output is the volume of blood pumped by each ventricle per minute. It is calculated by multiplying the heart rate by the volume of blood ejected by each ventricle with every beat. The nodal fabric. Without the nodal tissue, the heart does not contract, so there will be neither systole nor diastole, and blood circulation will not occur. The cardiac impulse originates in the sinus node via automatic myocardial cells, and then spreads through the conduction pathways. The nodal tissue is formed by sinus node, or Keith and Flack node. It is located subendocardially near the right atrium. It transmits electrical impulses to the left atrium and to the atrioventricular node. Atrioventricular node, or Ascoff-Dewara node. Bundle of His, which originates from the previous node, travels through the interventricular septum and divides into two branches, the right and left. Purkinje network is a continuation of the bundle of His and distributes the electrical impulse across the surface of the ventricles.